Can you share the slides, sir?
Sure, sure.
No,
Just a minute. Does my screen is visible to you?
Yes, sir.
Please continue. Yes, I think it's clear now.
Yes, sir. So today we will see the case of a lady on deathbed. Next, sir. Okay. One of my patients, who is a teacher by profession, asked me whether I can do something for his close friend's mother. I asked him about her complaints. Then uh, from his answer, I came to know that her lady is suffering from chronic nausea and taken treatment from so many physicians in the city without any relief. Then I decided to take this opportunity as I am also in early days of my independent practice. I taken her case in detail. We will see the case of performance. Okay, you can see how we taken the case. She is a lady of almost 68 years old, and her weight is 42 kg. So she is suffering from acidity. Acidity means nausea. Every physician told her that is only acidity, and for that everyone given her antacids. She is also taking daily antacids. Without antacids, she not feeling well. But after a few months, antacids also not working. Bony pains are there, flatulence is there, sleep also reduced, and stiffness in left abdominal region. Next. Now here the past history, her journey of disease. No any major illness in past, but there is a hysterectomy due to protracted menses. Protracted menses means due to profuse menses, metrorrhagia. Hysterectomy is done 20 years back. He's almost 10 to 12 years. That's why I write here chronic. She's suffering from nausea. The same water brush, regurgitation is there, burning is there, headache is there, nausea not relieved by anything, constant nausea, especially in morning after change in time of food, vomiting of uh, yellowish bile, and better in open air, but it is not so much marked. Next. Yes, there is a bony pains are there, cramps are there, flatulence is there due to heavy foods. Next.
Okay, so let me make it clear, Dr. Dhanashree. She's having chronic acidity, antacid, bony pain, flatulence, sleep reduced stiffness in abdomen. So I think if it is acidity, okay, then why we call this a lady on deathbed?
Actually, I also felt when she came to me for the acidity, I also felt the case is so simple. That is only nauseous there. But during case taking, I realized she is almost 10 to 12 years suffering from nausea, daily
Okay.
nausea without any relief.
Mhm.
And due to that complaint, her food intake is so much less. That
Okay.
is, her weight is only up to 42 kg.
Mhm.
When she came to me, she is very lean, thin, emaciated, and so much weak. When I asked his son, he told me that everyone who is watching her telling that now she is in the journey of death.
Oh,
She will not come
yeah.
out from this complaint or suffering.
Okay, okay. Okay.
Huh.
Now this is, I think, mental symptom you have taken. Okay.
Yes, sir.
So everybody who is watching our session first time, this is a way in which we take the case very properly as per the guidelines led by Dr. Hahnemann. We can prescribe on the mind, we can prescribe on the body, but as far as the case taking is concerned, we are very meticulous about that. As Dr. Samuel Hahnemann written somewhere that most respected or serious work of all profession. This homeopathic case taking, Dr. Samuel Hahnemann said that it is the most serious profession, serious type of work. Okay. So that's why you can see the effort that is taken by original case record, what we are sharing. Okay. That is very important. And I expect you to implement same in your practice. Dr. Dhanashree, tell about the mind,
Yes.
please, and we can proceed then.
Okay. Patient is extroverted. Actually, I want to explain. Now you can see this slide, you can read the symptoms. But when she came to me, her appearance, I want to share with you. And that will be in Hindi or Marathi so that we can express our emotions very clearly. सो जब वो मेरे क्लिनिक में आई थी, लड़के का हाथ पकड़ के आई थी, बहुत ऐसे वीक वीक थी, लेकिन अच्छे से चल पा रही थी। लेकिन जब उन्होंने बात करना शुरू किया तो जो वीकनेस बोलते हैं वो उनके वॉइस में था। मतलब वो बात मेरे सामने बैठ के बात कर रही थी, लेकिन बीच बीच में ऐसे लग रहा था कि मैं सुन नहीं पा रही हूँ कि क्या बात कर रही है। वो इतने लो टोन में, लो वॉइस में वो बात कर रहे थे। पूरा फेस, पूरा हाथ का स्किन जो है वो रिंकल्ड आए थे, हैंग हुए ऐसा लग रहा था। चेहरे पे बिल्कुल भी स्माइल नहीं थी। चेहरा ऐसा पूरा बिटर था। मतलब उनको देखने से ही पता चलता था कि वो कितने लॉन्ग टाइम से सफर हो रही है और उन्होंने अभी होप्स छोड़ दिए। ओके। और जब जब ये केस टेकिंग मेंटल्स का आगे बढ़ता गया तो समझ में आने लगा कि जब से लड़के की शादी हुई है, तब से ये कंप्लेंट्स थोड़ा बढ़ते जा गए। घर में सिर्फ डॉटर इन लॉ, लड़का और ये रहती थी। तो सारा घर का होल्ड जो था वो शादी के पहले वो खुद खुद के पास था उनके। जैसे शादी हुई लड़के की तो सारा होल्ड थोड़ा लूज होता गया। तो उसके वजह से डॉटर इन लॉ की तरफ उनका बहुत गुस्सा था, हेट्रेड था। वो जो भी करती है उनको मतलब सेटिस्फाइड ही नहीं थी, वो एकदम डिसकंटेंटेड थी। मतलब वो अच्छे से खाना परोसती थी, सब घर का काम करती थी, फिर भी उन्हें ऐसा लगता था कि वो कुछ नहीं करती है। इतना हेट्रेड उनकी तरफ उनका था। तो उसके बाद मैंने एलिमेंट फ्रॉम इंडिग्नेशन ऐसा लेके केस को थरली किया।
Okay.
अ,
Okay. I'll
हाँ।
try to interrupt here. So मुझे लगता है आपको ये केस बहुत अच्छी तरह से समझ में, एवरीवन हैज गॉट गुड अंडरस्टैंडिंग ऑफ द केस व्हाट शी सेड दैट शी इज इट इज अ 68-year old lady. This case you can see January 2023, and at that time she was on deathbed, almost about to die, and the reason was chronic acidity, constant suffering from that acidity, nausea, regurgitations, and it was so progressed that she was unable to eat. She was shown to many I think consultant in the city, right, Dr. Dhanashree?
यस सर।
And the issue was that after a marriage of her only son, when the new person arrived at home, I think this is very relevant topic to discuss today with all the uh, ladies, and they can relate themselves. Especially in India, you can see a lot of turmoil in the family, lot of changes in the social dynamics of the family, and here somehow it impacted this lady. Okay, uh, as she explained in Marathi, that the lady, when she was brought in a very, very weak condition, was not able to walk properly, emaciated. So you can see the gastric complaint impacted her entire health. Okay. And then other things you have in front of you, like physical symptoms, bone pain. Then there is a desire for sweet, warm foods, thirstlessness, and flatulence, bone pain, gastric complaint. Okay. So, Dr. Dhanashree, can you tell me your thought process, how you proceeded? Because in last case, we were not able to explore Natramur properly. So, I hope in this case, at least we can explore the remedy in quite detail. Please.
Okay. Then, after taking her details, then as a part of our classical protocol, I went in a depth, analyzed the case, and come to the totality of physical and mental symptoms. Totality, sir. Next slide, sir.
Yes, yes. Just a minute. So anybody can have any word about the remedy? I know this is a very short time for you to analyze. Okay, but in short, broadly, what we have: old age lady, very thin, emaciated, weak lady. Yes, Dr. Prajakta is with answer. Who has been suffering from gastric complaints, regurgitation, vomiting, that is badly impacted her health. She has a bone pain, flatulence, along with she has a lot of extremity pains, cramps, and the trigger was entry of new daughter-in-law in the family. So there are few excellent suggestions coming, like arsenic, like naxomica, and like sulfur. Also, she had history of bleeding, open air amelioration, staphysagria, naxomica. Now, Dr. Dhanashree, please tell us how you tackle this case. What was your thought process? And was
As
it
this is the as this is the case of early my very first years of independent practice. After a big gap of maternity leave, my initial prescriptions didn't work. Then I analyzed the case again and again in detail and finally gave the remedy which worked wonderfully.
so here,
Now,
Dr. Dhanashree, I'll tell you what remedies you were thinking about or given earlier. Can you tell me?
uh, in first uh, in first consultation, I given her pulsatilla.
Yes,
In
Pulsatilla
second
solution is here from Mahi. Good.
second, second prescription, that pulsatilla also failed, not given much relief. Then I given her Naxomica
Yes,
as there is
Omega is also
acidity.
here. Options coming from
uh,
Pranjal. Good, Pranjal.
Naxomica also not given her relief. So again, I analyzed the case taking in detail and finally gave the remedy, which uh, which work as a magic. Now from 2023 to 2025, she is with me and well managed case.
Okay, so
So and
the thing is that remedy was none of the above, not arsenic, not ignatia, not staphysagria, not lycopodium, not pulsatilla, yet very common remedy. Okay. So, considering the time constraint, I think we should proceed to next one. Anyone want to have any word of a remedy or uncommon rubric that we want? Natramur, very good. Anyone else? Okay, so let's proceed to the next slide and we understand this remedy very properly. I'm extremely happy that more than 50 people, even after interruption, joined again. Please, Dr. Dhanashree, continue.
okay. And after taking a totality repertorization, in repertorization, my totality is head pain accompanied by nausea, stomach nausea constant, extremities pain, bones, general food and drink sweet desire, extremities cramps in lower limb, stomach irritations type of SAG. So the remedy given was Ipecac 30,
Yes. Okay.
and which works very nicely. In first few days, her nausea get relieved, her appetite increased, and after her recovery, watching her recovery, the neighbors, her relatives are very happy, and almost 5 to 10 new cases came to came to me.
Okay. So
So
this,
is the
yes,
totality:
yes.
gastric complaints, deathly nausea, chronic bony pains, dissatisfied, element from indignation, not responding to staphysagria also, open air amelioration, lean thin constitution, history of PV bleeding and hysterectomy.
Okay, so I will request Dr. Dhanashree to please tell about this remedy a little bit detail, because today we are not here just to show you results before and after, but it should be a really uh, learning experience. You should get know about new rubrics, new symptoms, new aspect of the well-known remedy. So here in brief, we will try to understand about this wonderful remedy.
Okay.
Continue, please.
Ipecac, I think everybody knows about Ipecac, but today we learn something new rubrics, mind rubrics, physical rubrics about Ipecac, so that it easy to correlate with case and easy to find the rubrics with the symptoms. Next
Okay.
slide, sir.
Yes. So now we will learn Ipecac from Dr. Dhanashree's presentation, and please focus.
We will first see how the action of Ipecac on our body. Its chief action is on pneumogastric nerve, which produces spasmodic irritation in chest. In chest, it creates symptoms of asthma, secretion, cough, and its action on stomach causes constant nausea and vomiting. Next, its action on respiratory system. Second action is on respiratory system. It irritates the mucous membrane and due to that, increases secretions of mucus, which goes to fetal inflammation. And it causes continuous sneezing, spasmodic cough, dyspnea. And third action is on blood. That is a general hemorrhagic tendency. Next. With all symptoms, actually with any physical symptom or very little pain or any little distress, there is a accompanied with constant nausea. Any symptom is associated with nausea. Here is the temperament of the patient, that is bilious temperament. In Marathi we say pitta prakruti. So in our repertory, there are a few remedies which are very close to Ipecac. That is Noxomica, Podophyllum, Aesculus, Belladonna, Ipecac, Lachesis, Mercurius, Pulsatilla, Sulfur are very important remedies for the bilious temperament. Next.
So you can see many are missing, many are guessing Naxomica, Pulsatilla. So this all remedy can be seen here.
Now we will see our patient's chief complaint is nausea. Let's see the symptoms, few interesting rubrics about nausea. Nausea, nausea is not relieved by vomiting. Uh, there is a desire to vomit, but whenever the patients vomit, she again feels desire for vomiting instead of any relief. Maybe vomiting nausea will be relieved in open air, clean tongue with thirstlessness, vomiting of bile, that is yellowish or glary mucus in large quantities, green jelly like mucus is there, continuous nausea with gagging, constant unavailing desire to vomit. Now here is the symptoms, rubric stomach nausea daily. As we are seeing the case, how the patient suffers, that's why we taken the rubric stomach nausea daily. Here are the few remedies: Ituza, Cotalus horridus, Ipecac, Globulus, Stap, arsenic. These are the remedies for the rubric nausea daily. Next slide.
Yes. So this is not a simple nausea, but really I think pathological nausea. You can say syphilitic kind of nausea?
There are few rubrics of nausea. Stomach nausea, chill after. Stomach nausea, fats after eating. After fruits, after ice cream. Lying down on amelioration on one side. One side पे जब patient लेटता है तो nausea better feel होता है. Pork after, sweets after.
We'll go to the next slide.
Now, nearest remedy to the Ipecac, in which is similar in gastric complaint, similar to thirstless. Patient is also hot, open ear desire, cough. It's a respiratory action, and the sidewise left to right, mentally greedy, jealous, negative nature. Which is the remedy which is very similar to Ipecac in these all given points? Anyone can guess?
Okay, so we want you to be interactive here. I already told that this is a purely learning session, not just showing our result. In our clinical practice, many times we feel that this remedy is Ipecac or this remedy is something else, but it is actually Ipecac. So these points, can you tell me which is the commonest remedy? Yes, everyone. Many are with lycopodium. Yes. Anything else? Very similar to lycopodium. Similar hot, similar thirstless, similar gastric complaints, similar open air amelioration. Very simple. I think again, lachesis is there, definitely. See, lycopodium, again left to right. Lycopodium is right to left, right? So yes, Dr. Chetasri, Vaishnavi,
Prajakta.
Prajakta, Shinde, good. All are with right answer. Dr. Dhanashree, please continue.
Yes, sir. And the remedy is pulsatilla. Now we will see why, what is the difference? If these are the similarities, then what is the difference? How we differentiate between pulsatilla and Ipecac in the patient having same symptoms of gastric, thirstless, hot patient. All these are symptoms are matching with Ipecac and pulsatilla. So the differential point is that in Ipecac, the tongue is very clean, and in pulsatilla, the tongue is white or yellow coated. In Ipecac, the taste in mouth is sweetish or bitter, and in pulsatilla, there is a bland taste, matlab no taste. Ipecac, in Ipecac, the nausea is there when food is not in stomach, matlab empty hai or nausea ho gaye. But in pulsatilla, food is in stomach, still patient feel nauseating. These are the few differentiating points between pulsatilla and Ipecac. Next.
Okay, we haven't prepared slide of that because of time constraint, but this is difference very close to pulsatilla. Many times we completely miss it for pulsatilla. Please continue.
And there is a marked symptom that is restlessness with nausea. Means the patient whenever comes to me when any episode come, she always telling me माझी घालमेल होतीये. जेव्हा जेव्हा मला मळमळतं तेव्हा माझी घालमेल होतीये, जीव घाबरा होतोय. That is restlessness with nausea. In Ipecac, we see the patient is so much weak. Then why we not given arsenic? Why not given Restox for restlessness? There are the few points I want to share with you. In Ipecac, the prostrations comes by spell. मतलब जब वो बात करती है तो उनके टोन में जो वीकनेस रहता है उसको हम बोलते हैं कि prostration comes by spell.
Just a minute, sorry to interrupt, Dr. Dhanashree. Everyone, please pay attention. Dr. Dhanashree is very precisely explaining the difference in restlessness, right? Restlessness of arsenic, Restox,
and Ipecac.
Ipecac. Okay, please proceed. We haven't prepared slide of this.
In arsenic, the prostration is continuous. And if we see in Restox, there is a turning, tossing, moving hands and feet with restlessness. These are the some important hairline differentiation between Ipecac, arsenic, and Restox.
Can you repeat
Next, sir.
once again?
Okay, sir. In Ipecac, there is a prostration come by spells. Means the patient is so weak, but in her tone, in her spells, मतलब बात करते समय हमें वो पेशेंट वीक है ऐसा लगता है, बातों में वीकनेस है. In arsenic, there is a continuous and constant prostration. Uh, and in Rustox, the patient is turning, tossing in bed due to restlessness.
Okay, now we can proceed to mind. Okay, next slide, please.
Yes. Uh, Patient is hard to please, means discontented. मतलब her daughter-in-law also came to me for her husband's treatment, and that time when I asked her about in a mother-in-law's nature, she told me that she is very discontented. Whatever I am doing, she is not satisfied with that. So hard to please, that is discontented. Next slide, sir. Here are the some important mind rubrics, that is aversion, everything to, discontented, displeased, dissatisfied, everything with, cursing, indignation, bad effects following, contemptuous, anger, element after anger, vexation, phenomena, slander, disposition to, jealousy, and desires identified.
Indefinite. Okay.
Indefinite, sorry.
Okay, so you can see different aspect of this remedy, but I think it is one of the very much jealous, contemptuous, someone who is putting others down and very much greedy kind of remedy. Desires indefinite. Okay, and ailments from anger vexation is very important because it is exactly similar to Staphylococcus aureus. That's why I think many of us missed with Staphylococcus aureus.
Here
Yes,
is the
can you?
very interesting. uh,
Yes, please continue.
Interesting rubric about mind, jealousy, appreciate anything, desires that others shall not. इसका मतलब ये है कि दूसरे के पास जो है वो मुझे चाहिए और वो चीज दूसरे के पास होनी नहीं चाहिए. डू यू अंडरस्टैंड?
So it is, I think, extreme kind of jealousy, right? Which
यस.
the desires that others should not have, even shall not appreciate anything. Okay.
Yes. Ipecac is the only remedy. Now the last part, that is the child of Ipecac. As we see, there is a respiratory affections in children. Many parents came to us in clinic with the complaint that a child is suffering from cough. There is a lot of rattling is there, gagging, vomiting. Everyone experience have that experience, na? So Ipecac here works very wonderfully. At that time, we can think about antimatar, Kalibai, right? लेकिन cough with gagging, vomiting, rattling in chest. Next.
Yes, I'll go to the next slide. And sorry, there are Dr. Dhanashree, we have to sum up in next 5 to 10 minutes, 5 minutes only, and then we can go
Okay.
to the third, another amazing session from experienced lady for from Ukraine, author of 2 books, and we are really eager to listen to her. So all those who are here, please stay connected. The third session is going to be even more enlightening for each of us. Now about this cough and gagging, let me tell you everyone, this is very common. Patients comes and says like father comes and said कि child is coughing like anything and there is vomiting. खोखून उल्टी होती है, छाती भरली है, chest is full of mucus, coughing with vomiting, gagging. So please write in the chat box which remedy you can think when any parents come with this complaint, coughing with gagging or rattling in chest. Yes, Prajakta, Vaishnavi, excellent. I'm very proud of this our student who are still in their college and answering excellently. Yes, Dr. Shembekar Madam, Pulsatilla, Antim Tart, Rumex, very good. Very good, excellent. Rumex. Can you have more option? Ituza. Excellent. Ituza. Kalikarb. Okay. Carbovage. Okay. Okay. So let's see. The next reference we have collected Sambucus. Okay. Sambucus also has this kind of mucus, especially during sleep. Gelsemium is, I think I have to look. Justicia. So see, is it common or uncommon? Just tell me. A parent saying that he's coughing with vomiting and rattling. Do you ever experience in your clinical practice? Say yes or no in chat box. Yes or no? Yes. Now we will show the practical list of this kind of for this kind of rubrics, not from Kent, not from synthesis, not from complete repertory. Dr. Dhanashree, can we proceed?
Yes, sir. Child coughs, vomiting with. The remedies are Antimtat, Ipecac, Alumina, Bryonia, Drosera. Next.
So
Here is
isn't it
the
interesting? Yes. Yes, Dhanashree.
here is the mark rattling in Ipecac. That is, the rattling is force which can be heard throughout the room.
Okay.
Okay, and the trouble has come on rapidly. मतलब bad cold settles in a rattling curve.
Just a minute. Dhanush is explaining about the cough, but before that, I think most of you might have surprised seeing bryonia here. But yes, bryonia also has cough with vomiting. Remember that. Many of you, we know bryonia is completely thirsty remedy, but in dryness without thirst, bryonia is for 3 marks. Remember this. Many of us will be surprised that bryonia is very much hot patient require cold drinks, but cough amelioration by vomiting. Cough amelioration by vomiting. There are very sorry, cough amelioration by warm drink. Garam pani pilavar. There are very few remedies like spongia, lycopodium. Bryonia is also for 2 marks. So please remember these things about bryonia and don't get prejudiced that bryonia is only dryness. It has cough with vomiting. Yes. Okay, just a minute. I have to clear the mess I have created. Okay. I hope it is useful to you. Is this rubric is useful to you? Just tell me. Be active on chat box. Be attentive. Every rubric is going to solve your many cases. Dhanashree, Dr. Dhanashree, you were explaining about respiratory complaint of Ipecac. Please proceed because we have limited time.
Okay, okay. When we think about Ipecac in children, that is, there is a cough, rattling cough. Due to coughing, there is a face become red. Child is thirstless with convulsions, gagging, vomiting. We can think about Ipecac.
Yes, next
Here
interesting rubric in
common
front of you, please.
common rubric is there. Fingers in mouth, children put. Matlab, children are putting finger in mouth. In that also Ipecac is marked. Calcarea, chamomilla, Ipecac, and phosphorus. Ipecac is very close to chamomilla.
This is one of the
Next,
most important sentence of Dr. Dhanashree's presentation. In children, Ipecac is exactly similar to. Yes, in chat box. Which remedy? In children, Ipecac is exactly similar to. Please note that
uh,
this every sentence is going to help you in a lot in your practice. Yes, chamomilla. So
and in adult, Ipecac is very close to pulsatilla.
okay.
Okay. Here
Please,
the
Dr. Dhanashree.
same similar rubrics of Ipecac and chamomilla. Desire numerous various things, refuse when offered, striking stool during, striking pleased hard to be, striking in children, feast in mouth with, weeping cough during weeping children in babies, or obstinate, discontented, displaced, dissatisfied, everything with anger, element after anger, vexation, gesture makes fingers in mouth, puts in children, discontented, striking something, shouting continuously in children. Here are the some similar symptoms of Ipecac and chamomilla.
Okay, very interesting.
Next.
Yes. Next. So you see the typical behavior in children. They want one thing when given second, when given third, isn't it? That is we call as capriciousness, chanchal mula. So in the list of capriciousness, we were knowing about Sina, chamomilla, bryonia. Now you have one more tool, that is Ipecac, which also has fullness and rattling in chest. Okay. Please go ahead, Dr. Dhanashree.
Important physical symptoms. Next. Metrorrhagia, as I told. In metrorrhagia, sudden belladonna, arsenic, Ipecac. Female genital metrorrhagia, vexation after only Ipecac and Kalika. Next. Stomach indigestion, vexation after. As in our case, there is an element from indignation. Here are the only two remedies, chamomilla and Ipecac are marked, and tarantula for 1 mark.
Yes.
Next.
Yes, this is next rubric, Dr. Dhanashree. Please, can you see it?
Skin eruption, skin
So everyone,
eruptions, rash.
just a minute, meeting can be break again, and we will immediately join for the third and last session of the today, the Feast of Information with Dr. Larisa Hotsol from Ukraine. Please stay tuned. If you leave the meeting, please join again on the same. Just one slide remaining. Dr. Dhanashree, please conclude.
Skin eruptions, rash in children. Here is also bryonia, chamomilla, aconite, Ipecac, and sulfur. Next. Last rubric of the day, stomach vomiting, children in nursing, after nursing. For only for 3 remedies, that is Ithuza, Ipecac, and Sanicula.
Okay, so let's conclude here. Many times you see this kind of children who vomit